Asmadacharya Paryantam Vande Guru Parambaram. I am very much humbled to be in front of this august audience. It's our privilege to state or to share something from the southern end of India on this most auspicious day in Indian history. And that too about the Indian bioscience. As we are students, preachers, teachers, and advocates of Ayurveda, it's our responsibility to propagate it in the correct sense. More or less, it's unfortunate. I have to use that word, even if that should not happen, but it's happening. It's unfortunate that the real sense or vision and mission of Ayurveda is getting manipulated. It's not all on a sudden. It was perpetually happening during the last decades. Let us introspect a bird's eye view, not in detail, but a bird's eye view on the basis of what Charaka Samhita intended to propagate as Ayurveda among the scientific community, among the students, among the public, and around the globe. What was the intention of Charakacharya, rather Agniveshacharya, and again the later add-on Acharyas like Dridhabala, Gangadhara Rai, Gananatha Sen, so on and so forth, and the Guru Parampara. The entire Guru Parampara has a very productive, protective, conservative aim to help. It's not just help.
Jayalakshmi madam, your audio got muted. Please unmute it.
Excuse me, as one of my patients have called, they didn't know that I am in a session. Excuse me for the interference. And what I wish to introduce is the methodology of propagating Ayurveda, or the aim of propagating Ayurveda among us, among the specialists of Ayurveda initially, so that the parampara, the adhyayana, adhyapana, sampradaya, then practicing Ayurveda. That's not for us. It's for the public, no doubt for that. It's for the Jana or the Samuha or the Janapada, and the way of propagating Ayurveda for the society. And again, the way of propagating Ayurveda as a part of prevention. Prevention of what all things? Prevention of all Vikna Bhuta. What all obstacles are there to obstacle or to intervene the smooth running and attainment of Purusharthas. What all things? It may be Bhaudika, physical. It may be biological. It may be biochemical. It may be psychic. It may be sociological. Whatever may. From the minutest to the grossest, every obstacle which is a hindrance to attain Purushartha are subjects of Ayurveda physician. No doubt for that. It has been stated in Charaka Samhita. These all are not from my mind or my intellect. I am just compiling some or other points from Charaka Samhita for a better humanity. Why? Because I have selected as a representative of the Kerala sect, we select the why? Because Charaka Samhita has stated it initially that time immemorial, we may state like that because we are not well aware on which date, which time, nothing, no minutes are available. Only the Charaka Samhita excerpts are available that Viknabhuta yada roga pradurbhuta sharirina tapopavasa adhyayana brahmacharya vratayusham tada bhuteshu anukrosham Puraskritya Maharshaya Sameta Punya Karmana Parshve Himavate Shubhe. Really, from the southern end of India, we are more obliged to quote or narrate what all things had been happened on the shores or the valleys of Himalaya Parvata in time immemorial regarding protection, preservation, conservation, and propagation of humanity. That the total compendium is dealing with such an auspicious aim, and total methodology of Ayurveda propagation was also in the same path. Once upon a time. Now it's a story. We know initially I am not well aware about the platform or the methodology, what we are doing here on this platform, but I understood within 5 to 10 minutes that we all have same mind or our intention is common. That is why, based on the latest amendment of that act about drugs and cosmetics, we are discussing actively, we are involved intentionally, whether it has some loopholes that will dilute the purpose of Ayurveda or not. This should be the main agenda of every Ayurveda personality, whether it may be a physician, a manufacturer, a therapist, or an attendant, whatever it may, at last, not least, the beneficiaries of Ayurveda too. Now we know that the beneficiaries of Ayurveda is present around the globe. And at the same time, looters are also not less. What we can loot from Ayurveda, what we can, just like the colonial system, many are there to loot from Indian systems. No doubt for that. From every system of Indian intellect. But we should not allow that. It's high time to discuss on such a perspective. That is why from Kerala, we like to select how we can evolve a better humanity with the help of Charaka Samhita, making Ayurveda as a base or as a base platform. Because Ayurveda deals with eyes only. Life. Without life, there is no question of humanity or animality or nothing. So, if we want to be human, there should be life first. If we want to an uninterrupted life flow, definitely anywhere on the earth, one or other form of Ayurveda methodology should be adopted. They may or may not be knowing that they are doing based on Ayurvedic principles. But Ayurveda is working everywhere where there is an uninterrupted flow of life, no doubt for that. So this topic is an introspection. introspections on how we have to perform for the coming decades, coming 2 or 3 decades, because it's high time and it's a favorable time to, I feel. And let us go through the Charaka Samhita itself, because Adhikarana is very important when we are dealing with Shastra, Tadvidya, Sambhash. So today, my Adhikarana is Charaka Samhita. So let us deal with Charaka Samhita itself and discuss why, how, when, what these all things are significant. As initially I have mentioned, the Avatarana of Ayurveda was for uninterrupted life events. Whether it is just a past statement, no. It is as much significant as it was centuries ago when Agnivesha, Charaka, Atreya, Munis were discussing. At same significance is there at present also. Indicates even if it is Chira Puratanam, it is Nitya Nutanam. Even if it has happened from time immemorial, it is very much relevant on this 2022 August 15th eve. So that is the relevance of this topic, or based on Kala, because for every Ayurveda physician, there is a Guru Padesha. For every Ayurveda physician, before starting their practice, just before or during their Samavartanam process, there is a Guru Padesha. That Guru Padesha is that whatever you are doing, whatever you are saying, whatever you are thinking, Mano Vakaya Karmanam should be based on 2 variables. What all are the variables? Desha and Kala. So for me, for this particular presentation, Kalam or time is this era of a very fast-paced reformation taking place in the updating of Ayurveda principles, practice, propagation, everything. So it is high time to discuss these fundamental principles. Otherwise, we will forget. That's quite natural. We will forget some or other main points. It should not happen. So for me, this particular presentation is based on the Kala that it is high time to do reformation as per the updated life. And second variable, Desha. We are speaking from India. We are speaking for India. And we are speaking to the whole world. That is the thing. That is a significant thing. We are speaking from India and we are representing India, but we are facing or we are addressing the whole society, global society. So, Purusham Vikshya, based on individuals, how we can implement it across the globe? It's a very big challenge. We can't constrain it on one or other drugs and cosmetic act, one or other practicing and preaching act, nothing. Because Ayurveda is not that much restricted to make it under one frame. Rather, Ayurveda advocates, or particularly Charaka Samhita advocates, based on Desha and Kala, based on each individual or race, their Gotra. Atulya Gotriyam chapter is there on this Sharira Sthana of Charaka Samhita, based on the determination of genetics. So we are well aware that how to deal with human beings, how to deal with Desha, a particular race of people from Europe won't be like Indians. No doubt in that. We know. But we have to remember it. We have to remind each other. Otherwise, while we are framing new and new amendments or rules or acts, we will go wrong. It should not happen. So whenever we are generalizing some or other principles or practices of Ayurveda, we should be always attached to the basic principles of Ayurveda for a better humanity. Otherwise, the purpose will lose. Then again, why we need such things? What is the flaws of what all are the flaws of the present Ayurvedic scriptures or the available scientific material? Really, the flaws, really speaking or sincerely speaking, the flaws are not with the available scientific material or data. The flaws or the lacuna is with us, those who are dealing with such immense intellectual treasure. We don't know Sanskrit. We don't know how to interpret the text. We are not ready to by heart the things. We are not ready to interpret the by hearted things. We are not ready to do the Tadvidya Sambhasha as this platform is providing. It's, I think, only one platform where this continuous series of talks are happening for the last 1 or 1.5 years. See, we should be, or the authorities of Ayurveda, or the legal or representatives of Ayurveda should have a common consent that we are standing for humanity based on the available intellectual scientific scriptures regarding Ayurveda, and we are ready to learn more from what all available data in our text. For that, where we are lacking, we have to identify. These all are for a better humanity. We are evolving out as a better human being. Initially, we, then our clients. I am not stating that our patients, because the term patient in English language directly indicates that there is some abnormality. But Ayurveda is not aiming at abnormal psych or physic. We are aiming at normal personalities with equal significance. So those all clients should have a common consent or a pious consent that we have to live for each other. This message is from Charaka Samhita. So while we are remembering Acharya Charaka or commemorating Acharya Charaka in relation to the Charaka Jayanti, our intention should to follow him, or as many of the Indian systems stated, obey him. Because he is right Apta, no doubt for that. So obeying Apta is very easy. No need to clean and clear a new pathway for our journey. No need to invent or discover something new for the society. Just to obey and practice what all things have been mentioned here. And for that, why these all things have been mentioned, that thing should be crystal clear. At present, as I am an academician, I have every right to state that Ayurveda Academia is polluted to a great extent that it has crossed all its thresholds. And at the same time, I have a privilege to state that at present, there is a revolutionary reformation to detoxify the total filthy academic practices. I am 100% responsible on my statement. I know these all are above minimum revolutionary statements. So I am 100% responsible for what all things I am stating here. It is the true picture of Indian Ayurveda Academy. But what is the result of this? I am also a victim of such a filthy academic practice. And I'm not a very good teacher. Rather, I am not at all a very average teacher even. That guilt conscious is haunting me like anything because I have a preceptor. My Gurunathan used to tell that it's not your fault, Jayalakshmi. It's the fault of the system. And he was, till his last breath, he was in that much pain that we have to reform from the, oh, sorry. If there is any problem regarding the audibility.
Jayalakshmi ji, namaskaram. We can hear you clearly.
Okay. Oh, ഇതിന്റെ ഇടയിൽ ഒരു മലയാളി ശബ്ദമോ? ആദർശാണോ?
Madan.
Namaste. It's all right. Whenever there is an interruption, please let me know. Okay.
All clear. Thank you.
And we know that the process and procedures of National Council of Indian System of Medicine is vigorously cleaning up all the trash. And I am very confident in their proceedings. But the thing is that what all official proceedings has been happened is good. It should be there. But with whom? With this impaired academic faculties. How we can reform them? Charaka Samhita has clearly stated it. Yuganurupa Sandarbha. Yuganurupa Sandarbha means you have to be updated. Who? Initially, Gurukulas. What is Gurukulas with respect to Ayurveda? In present Kala, in this time, I have stated that two variables are there, no? Desha and Kala. And Desha we have confined, that is India, Indian academia. So, what is Kala? Today, the present day. With regards to the present day requirements, with what tool we have to make this official reformation? We are amending that act. We are reforming this rule. Okay, it's very nice. But with whom? What we have as an upakarana? In the scenario of academia, we have upakarana, or I am not using the word preceptor because preceptor is a much respectful word. I am not using teachers because teachers are also a much recognized position. I am just using, okay, that's very nice. I am not very much aware about the time limit. I will conclude. So, the teaching faculty group at present available, we should have an official, authentic introspection system. It's not to test them, or we have to make some entrances, we have to make some tests, we have to give them some points, or not like that. We should install a system of introspection. It should be the part of their culture of the total teaching faculty across India in Ayurveda Academia, that I have to introspect daily. not in every academic year, not with respect to every batch, admission or samavartanam, not like that. Every day, it should be a part of their culture that I have to introspect whether I am eligible to be a teacher in Ayurveda field. It is stated in Charaka Samhita, Vimanasthana 8th chapter, Roga Bhishak Jidiyam Vimanam there. We have every chances to examine and re-examine and update with the potential of every guru. Then only we can call them guru. Otherwise, they are just faculties. Nice, very nice way. This is from Charaka Samhita to make the academia more clear. I am not stating that foolproof or filthless. It would make the academia more clear if we are practicing, if we are installing such a cultural updating among all the available Ayurvedic faculty, teaching faculty across India. It's a practice. Yes, we have to initiate it. Next, regarding the student community. Now we know, as we are generalizing the standards of selecting medicos, we have made the NEET exams as the fundamental criterion to select a girl or boy as an individual, rather that's better, an individual as a BAMS student. Whether that is enough, sufficient? Really thinking. We are in a false thinking. I'm not telling thinking. We are not with the genuine side of Ayurvedic propagation. We are with the running water. Okay, if it's in the east-west direction, let us go in that direction itself. No, Ayurveda really not intending to do in such a way. Ayurveda has its own specifications. So we have to, after entering through NEET, we have to do Upanayanam. We have to do Shishya Upanayanam in such a way that it's not just Achara, but it's an Anusthana. We have to follow it. We have to inspire our individual students across India. We have to inspire them to be with the methodology of real Ayurveda studies. It's one hand or one wing of the total reformation of Ayurveda for a better humanity based on Charaka Samhita. On the other hand, the other wing or other hand is betterment of clinical practice with Ayurveda. Pure Ayurveda practice is a stigma now. What is this pure means? Pure Ayurveda practice, if you are really meaning it's pure Ayurveda, you can incorporate any authentic system, scientific system into your practice. You can, because Ayurveda permits it. Charaka Samhita itself permits it. It indicates Eka Shastra Madhiyano na Vidyat Shastra Nishayam. It has been stated in Sushruta Samhita. So, with the help of Atidesha Tantra Yukti, we have to interpret the Charaka Samhita treatise from other treatises references also. Ayurveda permits, wholeheartedly permits that what all authentic scientific methodology is available in your era, use it. That is pure Ayurveda. Should not go Chatmachara. We should be very thorough and sincere to the science what we have learned. That's Ayurveda. That we are clearing up through the clearing up of academia. Then during clinical practice, the code of ethics should be every day we have to update that. Not on every Charaka Jayanti. Every day, early morning, we have to. Such a culture we have to imbibe in among our students, among our budding physicians. Plus confidence. As an academic faculty, I know confidence of an evolving out Ayurveda student is below 5%. Below 5%, alarmingly low. What we are making, we are metamorphosing. They are good for nothing after 5.5 years. So, if we are really intending to constructive developments or reformations in the field of Ayurveda, I am concluding with the help of Charaka Samhita, with the help of Charaka Samhita itself. No need to take from any other text because it's that much enough. We can evolve a better humanity through the available faculties or fraternities of Ayurveda from India to the globe. I am again humbled to have this platform. I am that much grateful for your patient listening. I am that much feeling blessed that I could have speak for a 30 minutes, around 30 minutes regarding Ayurveda, its utility for the coming generations, representing the southernmost state of India, from where we all are trying to reach to the Himavat Sanus, where the real birth of Ayurveda has been happened, as we all know. And we are very much blessed to have a link from the Kerala to the Bengal, and this relation is making beneficial for the total humanity across globe, over the earth. And I am very much thankful to one and all, and at most thankful to my Gurunathan to make me to speak based on Ayurveda, about Ayurveda, and live along with Ayurveda for the utility of public. Namaste. Happy Independence Day. Azadi ka Amrita Maholsava Ashamsi. Namaste.
Thank you, Dr. Jayalakshmi, madam. It was a really nice introspection session. Actually, Dr. Jayalakshmi, madam, with initiative of Dr. Jayalakshmi, madam, Vishnu Ayurveda Parishad Kerala also have started a project called as Suputriyam. Means making a new individual and a new person, how to have the samskara of how to, from the progeny level itself, how to inbuild the samskaras have told according to the Ayurveda. So like that, the project we have been started called Suputriya. The major brain behind that project is also Dr. T.R. Jayalakshmi. Whatever she have told today is what she are practicing and what she are imbibing to her students. So whenever we going to her hospital and whenever we interact with her students, we can understand that whatever she told it, she is practicing 100%. So thank you, Jayalakshmi madam, once again, thank you. So I'll invite the next speaker. I'll request Dr. Harida madam to come on the dais. Dr. Harida madam is an assistant professor from Amrita Ayurveda Vidyapitham, Kollam, Kerala. She's also our Vishwa Ayurveda Parishad Kerala Executive Committee member, an active Karyakarta of Kerala. With her leadership and with her contact with all other faculties from Vishwa Ayurveda Parishad, from Amrita College itself, we were able to make around 90% of the faculties connected with Vishwa Ayurveda Parishad, and for the propagation of Ayurveda and for inbuilding our Ayurveda qualities and knowledge to the student community. So I'll request Dr. Harida madam to start the session.
Thank you, Dr. Adarsh. Just I am sharing the screen. Is it visible?
Yeah, it's visible, madam. You can continue.
One minute, doctor. I can't start my video. Okay, fine.
Madam, the screen is only visible. The PPTs we are not able to. I think.
Okay. 1 minute.
Now it's visible.
Full screen visible. Hello.
It's visible, but it is too large. If you reduce the slide size or go to presentation mode, we will be able to see this better. Haritha, could you move to the next slide? Then we can comment, see if this is a problem just with this slide or if it is.
This is the second slide.
It was too, Haritha, it is too large. I think you have scaled it out too much. If you go to presentation mode, it will be best.
Okay. So now it is on presentation mode.
No, it is not synchronizing correctly. The image is too large, Haritha.
Okay.
I can't understand why you have so much blank space around your slides.
Once more, I'll try to share, sir.
Open the file, Haritha ji. Open the
1 minute,
slide once again. Just start again. If you turn the presentation off and reload the file in PowerPoint. Yes, now load. Don't worry about, there might be just some problem with your machine.
Great.
While Haritha loads the presentation, I want to thank Jayalakshmi ji for inspiring presentation. Thank you for pointing all of us back to Charaka Samhita Vimanstan for learning how to refine ourselves for the future. Thank you.
I think,
Adesh, can you help a little bit?
Dr. Adarsh, shall I send my slide to you?
Yeah, you please send.
Okay.
Haritha, can you put me also in copy, Haritha?
Yes, sir, I'll send you.
My email address is in the chat box.
Okay.
Namaste, sir. Utilizing this time, let me also express my gratitude that I am very much respectful to you personally, because right from my BIMS days itself, I am I was worshipping this name, but it's for first time in my life that I am with you on such a platform to share some thoughts. Namaste.
Now, what is important, yesterday and day before, we have been discussing this thing. While we wait for Haritha's PowerPoint presentation, I just want to use the few moments. You pointed us to this last section, I think.
Okay.
Am I right? Now, what I want to highlight here, which I've been doing before, is how easy it is to work across the world. You know, I'm sitting here in England, you are there, and many of our listeners are in different places, and we can see all the details here online. We can share, we can discuss. And this is the speed, the new future for Ayurveda, because your comment was very important for us, and how we can actually understand and learn by using these new technologies, you know, and how we
Really, sir. Yes.
So you see, we can, if somebody says Vimanistan, we can look at Vimanistan. And to
Yes.
have made this happen, I want to thank Dr. Gopal Bashisht ji. Gopal Bashisht ji is a rheumatologist. You will know the story of this website, of this Charaka Samhita website. Gopal Bashisht ji is a rheumatologist of Indian origin, but he lives in America, in Florida, and he has worked there for many decades in Florida. And he decided, along with people, that we must make an online resource in Sanskritam and in a commentary in English. And along with this, we have very senior people, Professor S.K. Khandelji, from previously professor at National Institute of Ayurveda in Jaipur, and now in Jaipur, retired, plus so many other people here. You know. So your
Yes, sir.
comment, Vijayalakshmi ji, your comment that a lot of people are making big efforts to improve teaching, and you are reminding us. So we look forward to more guidance from you. Please continue to support this platform. Please join us again when time permitting. Please send your young students to help us with this program.
Yes, sir. Really, I am paining that much because our students are much potential, sir.
Yes.
My students, my babies are like they have the capacity to conquer the world through Ayurveda propagation, but they are lacking their confidence just because of our filthy academia. No, this is not possible for Sanskrit students. This is not possible for Ayurveda. What is impossible for Ayurveda, sir? Really, Ayurveda can guide this whole world because it's regarding life, alle. But
Let us see how to help these students, because we have senior.
we have to, sir. We have to make them potent enough.
Okay, we
Yes,
will
sir.
take this up in our discussion section. I have just received the PowerPoint, so let me see if I can display it from here. Please tell me
Okay.
if others. Please tell me if it is displaying correctly. I will put it up here.
Yes, sir. Sure, sir.
Is it, Adarsh, is it there? Can you see
Yeah,
it?
it's there, sir.
Okay, thank you. There it is. Is it clear?
Font difference is there. That
Font
Sanskrit, everything. Okay, everything is different. No problem, sir. I will do without slide. No problem.
No. Let us solve this. Is the font clear now?
No, sir. Not
No.
that. Actually, Trivida Roga Vishesh. That spelling everything has been.
Spelling is wrong. Now, Haritha, let me see if somebody else can present it. Maybe it's a problem with my system, Haritha. Apologies
Okay.
to all our viewers for this. I think Adarsh is presenting it from his.
Yes.
Is that better?
Yes, sir. Yes, sir.
Adarsh, thank you. Thank you very much. Is the format good?
Yes, sir. Yes, sir.
Thank you.
Okay.
Haritha, the floor is yours. You can.
Okay, sir. Okay. Thank you, sir. Thank you.
Thank you for being with us today, and thank you for sharing we look forward to learning from you. Thank you.
Thanks. So, humble pranams to my Guru, Dr. Mallika KJ, and respected dignitaries and dear students. So, actually, I am really privileged to be a part of this, as I am an executive committee member of BAP Kerala chapter. So, thank you all for this great opportunity. So, today I am dealing on the topic Insights from Trivida Roga Vishesha Vijnaniyam Vimanam. So this is the fourth chapter of Vimanasthana, Charaka Samhita. So of course in Charaka Samhita, there is a specific link between the chapters. So the preceding chapter is Janapadodvamsa Vimanam. So in that chapter, the Samanya Hedu for the Roga has been enumerated as Janapadodvamsagara Bhavas. The four Bhavas have been enumerated and the general description about the diseases has been done. So the next chapter is the Trivida Roga Vishesha Vijnaniyam Vimanam. So in this particular chapter, the three tools for the specific examination of the disease has been enumerated in this chapter. So this chapter holds to be very important in the clinical perspective as well as in the research perspective. So in the Trivida Roga Vishesha Vijnaniya, the core content of this chapter is regarding the Trivida Pariksha, that is Aptopadesham, Pratyaksham and Anumanam. So the importance of Pariksha has clearly stated by Acharya Charaka. Charagacharya even used the term Pariksha instead of Pramana. As it is a Chikitsa Shastra, the main aim is to examine the patient and do the treatment accordingly. So that is the reason the term Pariksha has been used instead of Pramana. So if you see the Mahachadushpada Madhyayam itself, the significance of Pariksha has been stated as Pariksha Karinohi Kushala Bhavati. So a physician or whomever person who is doing proper examination and commencing an action, that is considered to be the most best way, or he is considered to be an expert or a skilled person in that field. So this Trivida Roga Vishesha Vijnanas, these are the 3 tools to get the specific knowledge about the disease, and they have been enumerated as the Aptopadesham, Pratyaksham and Anumanam. So we can see the thread from the 11th chapter of Sutrasthana, that is Tisraishaniyam Adhyayam. There it has been stated that Dividameva Halu Sarvam Sacha Sacha Tasya Pariksha Chadurvida Aptopadesham Pratyaksham Anumanam Yuktishairi. So in this particular chapter of Trivida Roga Vishesha Vijnaniya, this 3 has been enumerated, that is Aptopadesham, Pratyaksham and Anumanam. So Acharya Chakrapani has clearly stated, Yukti has not mentioned separately. The reason is that Yuktehe Anumana Andargadatvenas, Yukti is already included under the Anumana. So that will be the reason here. These 3 has been explained in detail. And regarding the order of this Pariksha itself, the Aptopadesha has been given the prime importance. So that Aptopadesha has been mentioned the very first, because we should have the knowledge, theoretical knowledge, or the theoretical background is very, very essential. We should have the knowledge regarding the subject, whether it will be from the Guru or from the scriptural basis or from the textbooks. So the Aptopadesha Jnana is very, very important. So based upon this Jnana only, we have to proceed to the examination part or the next step, that is the Pratyaksha Jnana. And based upon Aptopadesham Pratyaksha, we do the Anumana and we can logically do the Chikitsa. So as Yukti is mentioned as one among the Chikitsa Upayogi Guna. Chikitsa Upayogi Guna as a Vaidya Guna, it has been described. So this is the logic behind the enumeration of this Pariksha in this specific order. Then next, the first Aptopadesha has been explained. Aptopadesha refers to the Aptavachana. And then who is an Apta? So regarding that, clear-cut explanation is given. In the Tisreshani Madhyayam, we will get the Lakshana or the definition of Apta as Rajastamopya Nirmukta Tabojnana Belenaye. The person who is devoid of Rajas and Tabas by Tabojnana Bela, such a person is considered, such a person is having the knowledge regarding the Trikala, and he should have the clear-cut knowledge. Such a person is considered to be an Apta. So in this context of Trivida Roga Vishesha Vijnaniya, a little more precise explanation of Apta has been given us. Apta hi avitarka smriti vibhaga vido. Apta is one who possesses avitarka jnana, that is the nishchaya jnana or the definite knowledge, who possesses good memory, and vibhaga vid, who can differentiate between what is sat and what is asat. And such a person should be devoid of preeti and upadaba. She should be devoid of this manasiga bhava like preeti and upadaba. So tesham evam guna yogyat, a person who possesses all these qualities, such a person is considered to be Apta, and the vajana of that person is considered to be the Apta vajana. And in this context itself, the non-authoritative, that is Apramana, or whose words should be considered to be Apramana, that is also mentioned as Apramanam punaha matta unmatta rekta dushta adushta vajanamidi. Okay, so the non-authoritative statement has been mentioned as the words of a matta. Matta refers to an intoxicated person, unmatta, those who have the diseases, or murkha, foolish, or rekta, who is asakta, a person who is always having this attachment. There are the words which that such a person is uttering, whether it is relevant or irrelevant, that should not be considered to be an apta vajana. It is considered to be apramana. So in this context, Acharya Charaka has beautifully explained about all these aspects. What is apramana and what is the precise explanation of apta, who is an apta, has been explained here. Then coming to the next one, that is the pratyaksham. So pratyaksham, the lakshana is mentioned as pratyaksham tu halutatya swayam indriyehi manasacha upalavhyate. So pratyaksha is that the knowledge that which obtained through the indriya and it is accepted by the manas. So here the panchayendriya pratyakshas and the different arthas what they are getting or what they are receiving has been clearly stated. So anumana is the inference which is based upon the yukti and the tarka. So these are the explanations of these three tools, that is apthopadesham, pratyaksham and anumana. And in this context itself, clearly it is mentioned for a jnanavada, a person who is knowledgeable, who is already possessing apthopadesha jnana. For such a person, the rest of the two, that is pratyaksha and anumana, is essential, is only required because he is already jnanavada. A person who is already possessed the proper shastra jnana. For such a person, this pratyaksham and anumanam only is inevitable. So that is the explanation for a jnanavada. The rest of the person should start from the basic part, that is the aptopadesha jnana, whether it is from the Gurumukha or from the theoretical background or the textual references. Then the explanations of each of this thing, what all are the significance in the treatment aspect. So that is clarified as the significance of aptopadesha. Through aptopadesha, we will get the knowledge regarding the various factors, that is rogam egaigam evam pragobanam. What all are the pragoba hedus of a disease? Yoni, what are the dosha involved? What is the specific manifestation? What is the atmanam? So what is the atma or the swabhava of the disease? Just like sannyasa is considered to be shikrobakramanatvat. So rohinyaha darunatam. Like that we can ascertain the swabhava, then adhisthana, whether it is sharirika or manasika, and then vedana visheshas can be understood, and also shabda sparsha rupa rasa gandha. So those arthas has been clearly explained. Then upatravas, what all are the complications? Then vriddhi, sthana and kshaya regarding the pradoshas. So udarka, the different complications of the disease, namam, the nomenclature of the disease, and also the proper application of the various drugs or the dravyas. So in this context, this nama, the word nama refers the nomenclature of the diseases. But in the context, in another context, in the 18th chapter, Acharya Charaka has been clearly mentioning, if we cannot name a disease also, there is nothing to get hesitated, because it is not possible to name each and every disease. That is vigaro nama akushalo na jihriyat kadachana nahi sarva vigaranam namado asti dhruvam, because it is not possible to name each and every disease. So a physician should not get hesitated if we can't name a particular disease. Then regarding the pratyaksha through pratyaksha grahya bhavas, based upon the panchayendriya pratyaksha has been mentioned. So what all are the factors which can be assessed or analyzed by strotrendriya pratyaksha? So the different aspects has been mentioned as andhra kujana, that is the gurgling sounds of the intestine, sandhi spudanam, then anguli parvana. And similarly, the different swara visheshas, the different Swara Vishesha from the Sharira can be analyzed by a physician based upon the Srotra Indriya Pariksha. Then similarly, the next one is regarding Chakshusha, based upon the Chakshurindriya, or through the eyes of the Chakshurendriya, based on Chakshurindriya, the various factors like Pramana, Chaya, different types of Varna Visheshas. So those factors can be clearly ascertained. So Anyatra Rasajnana. So just except Rasajnana, the rest of the four arthas can be perceived. But Rasajnana, it has to be, we have to ask the patient. We cannot directly ascertain. We have to ask the patient, that is, which is based upon the prashna. We have to interrogate the patient regarding the various factors, because certain lakshanas like Makshigoba Sarpanam, there is Yugaba Sarpana in case of Sharira Vairasyam. If there is Sharira Madhurya, there will be Makshigoba Sarpana, attracting of the flies to the body. So based upon those lakshana, we have to interrogate the patient and we have to find out. Then Sparsham, it is based upon the Prakriti and Vikriti. Prakriti and Vikriti, that is both Prakrita and Vikrita Sparsha, based upon the Sparsha Pariksha, we have to ascertain. So if you see the Indriya Sthana itself, starting from the Varnaswariyam Indriyam, regarding this Panchendriya Pariksha, the various things has been sequentially arranged. So we'll get a connection of this contents in the Indriya Sthana, starting from the Varnaswariyam Indriyam, then Pushpidagam Indriyam, the different Prakrita and Vaikrita, the Gandha has been enumerated or explained in the Pushpidagam Indriyam also. So there we'll get the a sequential order of this Panchendriya Pariksha regarding the different types of Vikriti. Next, coming to the importance of Anumana. So based upon the Anumana Pramana, Anumana as a Pariksha, we can ascertain the Agni Jarana Shaktiya Pariksha. The Agni Bala of the patient can be ascertained based upon the Jarana Shakti. Bala, the Bala of the strength of the person has been ascertained by the Vyayama Shakti. So similarly, Ayushaha Pramana can be ascertained by the Arishta Lakshanas. So like that, this Anumana can be also used in the diagnosis. So coming to the discussion part, this Trivida Pariksha is not only applicable in the clinical perspective, can be even useful in the research perspective also. So based upon the Aptobadesha, because the literary research, the base itself depends upon the Aptobadesha. So we are having the Chaturvida Siddhanta. So and in this, the Abhyubhagama Siddhanta. So Abhyubhagama Siddhanta means Emartham Asitham Aparikshidam Anupatishtam Aheduham. So till now, what is not proved, not told by anyone, which cannot be clearly justified till now. So such thing has been termed as the hypothesis. So that forms the base of the research study. So this Abhyubhagama Siddhanta has been found out from the various textbooks based upon the Aptobadesha Jnana. Then this Pratyaksha has been a wide range of applications in different level of studies like observational research, whatever experimental studies we are doing. And Anumana Pramana has been understood based upon that Purvavat and Sheshavat is there. So the case of Purvavat, that is the prospective study. From the course we are inferring the effect, and retrospective study, from the effect we are reaching back and finding the cause. So in the case of this retrospective, prospective and ambispective studies also, this Anumana Pramana is having a greater role. And Yukti, as it is not mentioned in this context separately, because this has been already included under the Anumana. So the Yukti is a Vaidya Guna or the Chikitsobayogi Guna. And the importance of Yukti has been stated in the second chapter, Abhamarga Tanduliya, as Matra Kala Sriya Yuktihi, Siddhir Yukto Pradishtida, Tishtat Yubari Yuktinyo, Dravya Jnana Vedam Sada. So the Yukti is the ultimate thing, that which the other factors like Matra Kala, all these factors has to be analyzed, and based upon the Yukti, we have to do the treatment. So the Yukti is the essential thing, both in a clinical perspective as well as in the research perspective. So these are the different research perspectives regarding this particular chapter. So why I have selected this chapter is because considering the clinical as well as the research perspective of this particular chapter, and this in the darshanas and all the different pramanas has been enumerated, whereas this Acharya Charaka has clearly stated the term pariksha as it is a chikitsa shastra, emphasizing more emphasis is given in the parikshana of the pariksha karinohi kushala bhavanti. A physician should become more skillful if they are doing the proper examination. So by this is the gist of this particular chapter.
Thank you, Harita. Thank you very much.
Thank you,
Sorry
sir.
about the problems we had with your slides, but it looks like I couldn't solve it, but Adarsh could. Adarsh, namaste. Thank you for helping us with the slides, Adarsh.
Thank you, sir. Thank you.
So happy that you could do it from your mobile phone with such expertise. Thank you.
Thank you, sir. Thank you. Sorry. I forgot. That's why I shared with the phone. Thank you. Thank you.
I'm sorry I couldn't show it here because of some clash between the format, between the Sanskrit display of the Sanskrit text, the Devanagari script. So, Adarsh, your floor is yours to take us to our next speaker. Thank you. I think Rajeshwari ji is here with us.
Thank you, Dr. Hetman, madam. Thank you for your.
Adarsh, will you do it or do you want me to? Because you know our next speaker, you are the best person to introduce. Adarsh, we can't hear you. You are, Adarsh, you're muted. No, we have lost your voice. We can't hear you. Shall I proceed? Rajeshwari ji, thank you so much for being here with us today.
Good evening, sir.
Good evening. Could you go back to your first slide, Rajeshwari ji?
Yes.
Then you, I think Adarsh is having some problem with his microphone. There we had this, Agni ji had the same problem yesterday. We are very happy that you could join us. You are here with us, joining us from Kollam, from your college. Thank you for joining us today. And as you well know, we have been having these meetings for many days now. And we are almost to the last day of this 2-week session. We are happy you have joined us today and you want to tell us a little more about yourself. Do we wait for others to introduce you, or would you like to introduce yourself, Rajeshwari ji? You can tell very briefly about yourself, where you studied, where you did your BAMS and MD and your PhD, or MS and PhD, and maybe very quickly why you have chosen this section from Charaka Samhita.
Okay, sir.
I'm delighted to see so many people from Kerala talking about Charaka Samhita, when in fact much of Kerala follows the Ashtanga Hridaya tradition. So everybody is curious to hear about that also. Thank you for joining us, Rajeshwari ji.
Welcome, sir. And am I audible, sir?
We can hear you clearly. Thank you.
Okay. I'm Dr. Rajeshwari. Presently, I'm working as Associate Professor in Amrita School of Ayurveda. I completed my BAMS from Alvas Ayurveda Medical College, Moodbidri, and post-graduation from Government Ayurveda College, Bangalore. And I completed my PhD from National Institute of Ayurveda, Jaipur, in the year 2014. Presently, I'm working in Amrita since 8 years, sir. Okay. That's a very short introduction about me. And if you don't mind, I can start with the topic.
Thank you. Thank you for giving us a brief introduction. That was a very, very swift, but very complete introduction. Thank you.
Okay. Okay. Very good evening, everyone. It's my much privilege to be in this platform today evening. And as you know, my profession and the subject of my post-graduation is Shalya Tantra. Still, we follow Susha Samhita there. But there are few challenges we face when we are following other texts, and that's why at times we need the help of Charaka Samhita or Ashtanga Hridaya also. So this is a one chapter where we mostly follow the concepts of Acharya Charaka rather than any other authors in the treatments. So basically, I'm working on these urinary diseases from past 3 to 4 years because I had taken an additional degree in this integrative urology from Mumbai Kidney Foundation. And that actually inspired me by taking a long way with the urinary diseases. It was found that Ayurveda can do much better relief to the patient in a very short span of time. And that's why I have taken my title of the topic is Clinical Challenges and also Essential Medicine in Ayurveda. We know that essential medicine in Ayurveda is something strange because most of the patients or most of the students will ask us whether it's possible in Ayurveda. So in my presentation, I just give a glimpses where we can have or where we can move towards the step of essential medicines with the Ayurvedic formulations or with the concepts of Acharya Charaka. So in my presentations, I have two challenges or two categories I have made. One is clinical challenges and another one is Ayurveda as an essential medicine. I'll just give a brief report of a patient where you can see I have highlighted some of the points where the crystals, urinary crystals are present, that is calcium oxalate crystals are there. And there is another ultrasound report where we get like cystitis is there, mild fatty liver is also there. Why I have quoted this is in Ayurveda, wherever or whenever we start a treatment, it starts with Agni. So this is the one report which gives us more clarity about understanding the science along with the modern developments and also modern investigative methods. See, there is a pathology saying that whenever there is a fatty changes in the liver or any absorptions or metabolism related issues in the liver, it will be implicated or it will be seen in the urinary system of the patient. So in the form of calcium oxalates. So that was just a point to remember so that we can discuss about that particular point in the coming slides. And here in the Charaka Samhita, we will get this particular chapter that is about the urinary diseases. We get in two contexts. One is in Trimarmiya Chikitsam and another one is Trimarmiya Siddhi. So when we are just looking into the chapters of Trimarmiya Chikitsitam or Trimarmiya Siddhi, we must look back what exactly he has explained in the previous chapter or what he is explaining in the upcoming chapters. So that gave us an idea about the treatment of urinary diseases in case of in most of the acute conditions and also most of the chronic conditions. So that was an alarming information we could get from the reading of Charaka Samhita in relation to the previous chapter and also from the in relation to the upcoming chapters. So for example, if I want to just give an introduction about that, Trimarmiya Chikitsitam is explained after Dvivaraniya Chikitsitam. That is, he has explained about Shariraja and Agantuja Karanas for the Vranas. Now, the next chapter Acharya is telling about if the Vrana is present in Trimarma, what are the managements or whether it is possible to treat. So that is the one area where we can get, there is a inclusion of Shariraja and also Agantuja factors in case of in the onset of urinary diseases. And after this chapter, usually he has explained Urustamba Chikitsa. So in between Trimarmiya Chikitsitam, the commentary says that this chapter comprises of so many diseases which can be treated by Panchakarma therapies, whereas In the Urustamba, it is a disease where we cannot treat with the Panchakarma therapies. So that was a triggering point where we can understand that in almost urinary diseases, Acharya Charaka's concept is go for a Panchashodhanas. So that will be giving much more results to the patients. And if it is not required in acute conditions, you can go for the chronic conditions. Absolutely, there is no any contraindication for that. Next comes importance of Agni. So in every chapter, as I showed you the previous report, there was an importance of Agni. When there is metabolic diseases are there, whenever there is a problem with the metabolism and also the conversion of one component in the body to the other, there will be an additional component formed, which is not required to the body. So that's what happens in fatty liver also. So which in turn gives us a metabolic waste product, which gets piled up in the blood, that is calcium oxalates. So there comes the importance of Agni also. Next comes Basti is Basti Marmagata Vyadi. So Basti is considered as one of the three marmas, and in Trimarmiya Siddhi we get so many explanations of Mutragata and all, and that's why in Basti Marmagata disease it is, and it should be treated, it can be treated with two types of Basti, that is Basti, another one is Uttara Basti. So in this concept, we can identify that Basti is considered as the most important treatment methodology, which is described in case of urinary diseases. And that is the thing what we are going to get in almost all the chronic conditions of urinary system. We are going to apply this rule where we can get swift reliefs in the patients. Next comes, there are few clinical challenges will be arising when we take up a new topic or when we are able to analyze some of the treatment principles, or we'll be facing some problems when to identify its prognosis and to explain the limitations. And at times we are not aware how the education to be given to the patients, that is self-awareness should be given to the patient related to his illness. And the last one is whether there is a need of integrated approach, whether we need other system of medicines to help. So all those challenges we can identify step by step, and we can give answer in a very conclusive way, telling that whether the possibility of essential medicine is also there. This question also must be answered here. As we know, if we are few of the audience who are curious about what is essential medicine, you can just imagine or you can just understand it like primary healthcare medications, how a patient obtains in the primary healthcare centers, which is very cost effective, and also which is run for a small duration of time period, and it is going to give complete relief of this illness. So whether we can opt or whether we can follow such medications, or whether we can formulate such medications so that the patient will be having a very short span of hospital visits, and he can get some kind of complete relief to his illness. So these are the few examples what exactly the essential medicines is going to be considered according to WHO. The challenge comes whenever there is a understanding and interpretation of concepts. So I have mentioned some 7 challenges. In that, one of the challenges is the interpretation of the concepts. It's not so complicated. Only thing is we must get into the depth of the nidanas or the samprapti which is being explained. If you look into the text like Charak Samhita or Sushruta or even Vagbhata, that is Ashtanga Hridaya, in all the Samhitas, they have given the doshas which are causing these particular diseases. In that, Ashmari is predominant of Kapha dosha, whereas Mutraghata, Mutrakrishra is predominant of Vata dosha. And it doesn't say that it is not at all involving Pitta. It is there, that is Taratama Bhava of these doshas are there, and majorly Kapha and Vata takes up the priority, so that the illness it must be treated according to this doshas. And there is one more point we must include, as per Charaka's opinion, that is Vata Rakta Chikitsa. In almost all the diseases, if we are understanding their basic concepts, how it has occurred, like in what I was explaining, the first slide related to the metabolic waste products which are remaining in the body, that is giving rise to some of the other illnesses. So for that, we must include the Chikitsa Sutra of Vata Rakta. So that will be the best method to incorporate the additional benefits to the patients in the diseases like Ashmari, Mutraghata, and Mutrakricha. Ashmari, as I told in Charaka Samhita, it is a disease which is predominant of Kapha dosha. So all the treatments which are against kapha and vata can be incorporated here. Once again, when it comes to the kapha, here there is a confusion, or some students can ask us, like kapha dosha pradhana is there, but if you look into the details of the treatments explained by acharyas, it is something related to Basti or Uttara Basti are available. So Vamana is not so widely explained by Acharya, because he is telling about the other, the dosha involvement he has given the most important along with the sthana. So dosha includes, even though it is vata, it is sthana is apana vayu sthana. That's why the Basti is considered to be the most appropriate treatment in cases of urinary diseases. There are lots of theories saying that this is a etiological factors for formation of urinary stones and all. The only thing what we need to understand is what is the basic mechanism which is happening in the body. So I would say that description we get very nicely in Sushra Samhita also. And whereas Charaka Samhita has given only importance to mostly he has given more importance to the treatment aspect, whereas in Sushra Samhita we will get the reference of how the theory is going to explain, like how this formation of Ashmari happens stepwise. So that is when we are referring such kinds of references, we can easily understand what the mechanism is happening. So I would say that in all these five to 6 points, what I have mentioned, there is a problem with the diet of the patient. There is a problem with the digestion, metabolism, and metabolisms. So if you are understanding the disease pathology in this level, with the concept of Agni, with the concepts of doshas, dhatus, and sthana, then we are easily able to administer the treatments which are explained by acharyas with very good rationality. It is not just randomly applying so many treatments to the patients. It is apt treatments in the particular stage of the disease. So that will give us a quick relief in the patients. So when we achieve that, our treatment can be upgraded to the essential medicines. Even in the context of Mutraghata also, the difference between acharyas are also there, but Acharya Charaka says that Mutraghata is Mutra Avarhoda, and this Mutra Avarhoda is because of Mutravaha Sroto Dushti. And it is a Vata Pradhana Vyadhi. So he'll give most of the treatments in Mutraghata as Basti or even Uttara Basti. In Mutraghata, we need to identify the causes. This is a challenge to the physician. We must always not only concentrate the treatment, we must identify what is the etiological factor that has caused this particular illness, whether it is a congenital, neoplastic, traumatic, or infective, or obstructive, or habitual changes. This is one of the most important presentation of the patient. Habitual changes will be there, where he'll be or she will not be using the public toilets. They'll not be going. They'll be having Vega Dharana kind of habits are there, then it is going to give the Mutravaha Sroto Dushtis. So when a patient comes to us, we must concentrate on these points so that we can come to an apt diagnosis first before planning the treatments. So again, these are the 12 types of Mutraghata explained, and the 13th one is Basti Kundalika explained by Acharya Charaka. And Mutra Krichra is also there. So here we can either include almost all the urinary diseases wherever there is a difficulty in passing the urine. So that description we get in Dhallana's commentary, Mutra Krichram Dukkhena Mutra Pravrittihi. There will be a painful micturition. So we can list out a lot of diseases where the dysuria will be the common presentation in the patients. So it is not only because of the urinary stones or urinary tract infections alone. There will be, in the female, there will be some gynecological diseases will be there. So that also we must address. So why Vata Rakta principle is taken in this particular context? As I told, the ultimate outcome is acute renal disease or the chronic renal diseases, which happens because of lots of processes which are going in the body, starting from the ahara of the patient. So in this, if we are coming towards the other system of medications, other system of medicine, see how we assess this acute renal disease or chronic renal disease is based on the blood or serum samples. So the blood becomes the media for expressing the most of the diseases. So there are good descriptions of the single drug medicines in Charaka Samhita, which are explained in the context of Vata Rakta, and that can be indirectly taken into the clinical practices when we are just in a want of some kind of like single medicines. Guduchi itself, you can make it a kashaya and give to the patient. So that will be the best drug for Vata Rakta. So that kind of descriptions we can just sort out from the chapter, and that will give a most appropriate benefit to the patient. So the challenge comes whether the disease is completely curable. Yes, we need to differentiate to explain to the patient or to understand ourselves where we need to address the case or how we must plan. What is the nature of the diseases? First, you can advise a Nidana Parivarjana line of management. Then you can go for all the other things. Whether you must categorize whether Sukha Sadhya, Krichra Sadhya, Yapya, and Asadhya. And based on that, we need to plan the treatment principles. So if you look into these two chapters of Charaka Chikitsa and Charaka Siddhi, we'll get these are the set of treatment principles which are explained for almost all the urinary diseases. Either an adopt an Vatahara Chikitsa, adopt a Kahvahara Chikitsa, adopt Valmana Basti or Uttara Basti, Avagaha Sveda, Vatavyadi Chikitsa, that is based on the Taraptama Bhava of the dosha. Most of the conditions will be with the Kapha dosha, and there is an involvement of Vata dosha also. Such categorization you must assess, and Apana Vayu Chikitsa must be given because the sthana of the Vyadhi is Basti. So these, and even Aushadha Kala also we have to plan according to the Apana Vayu Aushadha Kalas. So if we are keep taking these basic informations given in the text, then we can plan the medications or treatments accordingly. It's not, I'm not explaining the list of medicines. These are the commonly used list of medicines from many other texts also, but these principles remains the same. These principles are very important, and if we are understanding the principles, then treating the patient may not be a big task to the patient, big task to the doctors. Now, just I'll show some of the cases where I had applied the similar treatments and where we can get some kind of relief in most of the complicated conditions. This is a case where the patient was diagnosed as a neurogenic bladder, And these are the clinical reports of the patient, where he in his childhood he had myelomeningocele. So that was the reason for all urinary issues, that is incontinence. In a condition, he was presenting like urgency is there, increased frequency is there, nocturia is there, urinary incontinence is also there. He was at 24 years, and we could examine the complete detailed examination of nervous system also. But the motor, sensory, and anal reflex, everything was normal. Only the problem was with the detrusor muscles. So the muscle was not functioning well. So there was a post-voidal urine was also present, and all these were diagnosed by the urologist, and they had given a bladder diary. That's it, and there was no any other treatment was given. So in this, we planned a simple Panchaprasthitika Basti for 5 days, and it was we were not sure how the patient is going to respond, and to get an add-on benefit, we had explained this Kegel's exercise, and almost all the results of the patient was documented in a King's Health questionnaire, just to know that whether there was any improvement was there. So surprisingly, there is a emotional improvements, and the frequency in nocturia, incontinence, etc. were showed a minimum improvement, where the residual volume could decrease compared to the first visits. So this is a case where cystitis. She was a female who was having a low back pain, and that she was treated by many doctors, saying that it was something related to the lumbosacral spine, but it was not related to lumbosacral spine. The pain is confined to suprapubic region, and it was having some relation with the micturition also. It is radiating nature, and most of the symptoms what she was telling was confusing with the low back pain. So that's why the diagnosis becomes very important when we are treating such conditions. So the sonological reports say that it is a cystitis, where it was silent because she didn't had any episodes of fever and all. So that's why we couldn't identify. The next visit, it is hardly after 2 or 3 months, she completely relieved. But this even it may look like a long period, but the symptoms of the patients were very severe. We had not given any extra medications to the patients. It was only Guduchi, Kashaya was given, single drug, and Chandraprabhavati. Some medicines are very small prescription was given to the patient. The only problem in her was it is something related to her occupation. She was not voiding the urine on time. She was practicing the Vegadharana. So when that training was completely changed, or when that habit was completely changed, the patient could get the benefits. So that aspect is also very important, where we need to give more importance to their viharas also in diagnosis. So whatever I'm explaining today, it is always related to the diagnosis for the first time. Then we need to take up these diagnostic points from Charaka's concepts, but later we must analyze it in both the sciences, because most of the patient will come to us with lots of reports, so we must interpret them also, but at the end our treatment should be with the Ayurveda principles. This is a case 3 where the patient was having a nephrotic syndrome, and we started all the treatments for nephrotic syndrome in combination with the Vatarakta Chikitsa, and also the Agni was given more importance here. But she was a diagnosed case. But the surprising point was there was a fluctuation in the results. In some days, the patient was getting good results, and there was no edema, whole body, that anasarca was completely reducing, but after a few days, it was relapsing. So that was an alarm for us, telling that there is a sudden rise in the albumin, and high potassium levels is also present, and there is a fluctuating blood pressure, and there was a need for the system of medicine to intervene. So we could not take a chance. So these challenges also we must address, and we must speak about them boldly, because there is no harm in speaking them, because it is going to save the time and also life of the patients. So this is a example where the concept of Agni must be clinically applied. This I was stressing from the beginning of my presentation. See, the patient's gamma GT and also urinary protein is positive here, and gamma GT is 34, it's raised. And only when we understood the patient's diet is not proper, patient is not doing any exercise, his work pattern is like that. That's why we could advise only Agni Chikitsa here. Only the Agni Tundi Vati was given, and we asked him to change his diet, and that gave a sudden change in his the gamma GT levels, and urinary protein it became. So most of the times when we are patients are coming with us with the reports, they'll give us a hint about what to diagnose and how to plan the treatments, so that we can just keep all our senses open to just observe them, and to get back to our science, to understand and what the acharyas have meant in this concept, and just to apply those medicines, we are going to get the results. So are we able to give this concept of essential medicine in urinary diseases? Is there a possibility for a patient to get relief from his or her urinary infections or any other urinary diseases in a very short duration? I would say yes. You can see this report where patient comes to us on 29th of October, and the urinary report says that, urine analysis says that the appearance of bacteria, it's cloudy, and epithelial cells is negligible, but still it is the organism isolated was Escherichia coli, and within 4th of November there was a sample which was clear, and the illness and also all the discomfort of the patient was disappeared in a very short span of 5 days. So here also this is a patient who is coming with the raised uric acid levels. So the Agni becomes the most important point in almost all the urinary diseases, and also in almost all the diseases we have the importance of Agni. But specifically, as speaking on the urinary diseases today, I would stress that if you correct the digestion of the patient, and if you are managing the diet of the patient to some extent, the 25 to 30% of the illness we can address at that level itself. So what limitations we have in when we are treating? There are lots of limitations we have. We must be aware of those limitations also when it comes to the electrolyte imbalances, malignancies, or renal failures, or when a patient demands for that change of the treatment, that also we need to address. And congenital anomalies, at least we cannot touch such cases. So these awareness should be there for the consulting doctors, and also we must share these informations to the upcoming generations also. As a teachers, it's our responsibility to just pass on these messages. So what community education you can give? Yes, we must educate a patient about their illness. So whenever they come to us with the issue, we must tell that, like, we must give them 5 to 10 minutes, and we must make them to understand what are the conditions they are undergoing or what problem they are undergoing. So in most of the conditions, we may think that the patient monitoring by himself may not be a possible way, but there are lots of possibilities are there where he can monitor his illness, and he can come to the doctors in the follow-up, and this will give kind of support for the treating doctor also. When the patient is known about his illness, the response to his illness or the care towards his illness will be more when he is completely aware, provided we must know that when to reveal such few conditions, when not to reveal some of the conditions. And I would say example of when we are treating the conditions like chronic kidney diseases, we can restrict the number of visits of the patient by using some of the technologies where mobile apps are available to identify his EGFR levels and all. So such things we can incorporate in our practice, so that will add on some benefits to the patients, and also it saves a lot of time of both clinician and also the patients. And we must look into the in and around what is going on in other systems also, or what additional or what add-on therapies we can advise to the patients. So one such therapy is pelvic floor exercises and also scheduled voiding. So these are the most important points we must inform to the patients. There are, the last challenge what we have is there a need of integrated approach? Yes, there are a few conditions where we must depend on integrated approaches, so that we cannot deny in certain patients when they are having systemic illnesses related to other bodily diseases. Then we must include them also, like hypoparathyroidism in urinary diseases is having a very wide influence. You can see a patient repeatedly coming with urinary calculi, and if you're not testing his hypoparathyroid hormone, parathyroid hormone, then it will be a mistake from our side because of the hypoparathyroidism, which is having because of that, these episodes of renal calculi is relapsing. So that we must understand, and we must just ask the patient to go and get the treatment done for that. Or if you are treating such cases, you can plan with our Ayurveda treatments also. So even we must be careful when patients are associated with diabetes and hypertension also. Time of immediate referral. This is also a point we must remember. One is whenever the condition is beyond our limits, we must take a decision to refer the patients to the centers where they have the facilities. Maybe it's Ayurveda centers or allopathy centers. There is no any difference in such cases, because if you are referring a patient on time, the patient will really congratulate and also bless us, because he has reached the place where he can get the right time, right treatment on right time. So that also we must incorporate in our practices. So there were a few points where I was just concentrating on Hetu, Linga and Aushadha, which are very important as per Charakacharya. And this is to understand the disease, diagnose them, and also to treat. But there were few points where as a clinician, I wanted to share with you. These are the challenges will come to us when we are practicing with the open mind and open heart. So that's why I would have included those points in my presentation also. And if we are just taking up these three sutra of Ayurveda, so this is the greatest contributions of Acharya Charaka. And wherever we see the descriptions of Hetu, Linga and Aushadha, if we are keenly observing those descriptions in our classics, so the first and foremost importance they have given is for the diagnosis and then to the treatment. So wise clinician must diagnose the case before treatment. That's why even Dr. Harita was telling, there is no, if you don't know the disease, we must be either able to understand them or analyze them by using the dosha siddhantas. At least that try, at least we must make to give the best treatment to the patient. And only the intention of my presentation is that most of us are working on the area like chronic medications or chronic illnesses and their treatments through Ayurveda. So now that time has changed, and we must look into the diseases where we can give some acute treatments in acute diseases also. So with that intention, we had started the treatment of urinary diseases, and we are successful partly in treating most of the urinary conditions with a very less stipulated time period. So I would just like everybody to just think in this angle, where acharyas have given the medications are divided, like agraushadhas means easy to consume, and they are having a very specific actions, and you can restrict the number of medicines itself. And there are therapies which give maximum benefit to the patients, and there are maintenance medications. So this kind of thoughts we must every day we must think, and we must analyze them, and we must bring into our practice. With this, I conclude my session, and I thank everyone for giving me this opportunity, because this is a rare platform for me, and this is the first time I'm into this. And I hope all our efforts will be carried further with a positive vision, and that will benefit, and that will give an add-on benefit to Ayurveda also. That's our ultimate motto. It should give, all our efforts should contribute to Ayurveda. So in this occasion of Independence Day, I thank everyone for giving me this opportunity, and I congratulate other speakers also who has got this opportunity in this session. Thank you.
Rajeshwari, thank you so much for being with us today. And many comments you can see in the chat box. There are many comments coming through about deep admiration for your presentation and the clarity you have offered. And to most of us listeners, the ease with which you have switched between Ayurvedic thinking and aspects of contemporary diagnostics and medicine, and how you can move between these two. This is, I assume this is the future. Many people feel that once you move to the other side, you lose the clarity and the purity and the emphasis that can be offered in one side, the Ayurveda, or the other side. But you are telling us that we don't have to lose that. I just want to see, Rajeshwari, Adarsh, who was going to introduce all of you and who has brought all of you here. In between, we lost his microphone. Let me just see if Adarsh, namaskaram.
Namaste, sir.
Oh, your microphone is back. Thank you. I will leave the floor for you for to continue for a while, and then we will go around and listen to our.
Thank you, Rajesh Madam, for your insightful presentation.
Rajeshwari, if you could stop sharing your screen, then we can see everybody on the screen. Thank you. Thank you very much. Adarsh, all yours.
I think, sir, we can go for the discussion section for a while, so that any
Thank
other
you. Adarsh, in between, thank you. Thanks to you for bringing all these excellent speakers to the platform today. Please continue to add more speakers to the platform. Pavanji does a lot of work to put together programs. He makes a compilation of the programs for the whole month in advance, so you will receive a copy of that. And please recommend speakers and bring more people to the platform. Number one. Others, thank you also for arranging to view the slides, Haritha slides, which I couldn't do. Thank you for doing that.
Thanks.
We start with you. Are there some comments on our platform, some comments on today's presentations, and some comments on what you want for the future? We have, just before you came, we were looking at 15 points, a list of 15 points that Pavanji wanted us to think about. for this platform. And we would like to hear from you too, some ideas, some thoughts.
Yeah, yes, sir. Thank you.
I will present those 15 points that I'm roughly sketching here so that you can see the three themes that Pavanji wanted us to think about. We call it the Society's 5-point action plan on India's 75th Independence Day. Apologies for any typographical errors here because I'm just compiling this. So on 3 topics, strengths of Ayurveda, we've heard from our speakers today. The actions that he wants, excluding webinars, this is the main activity for us right now, but some other activities, and what individually we are promising to do. So I leave this, take this away, and we'll come back to this, but those are the 3 areas. Thank you, Adarsh. Thank you, Flores.
Sir, actually, thank you. I gone through your points. Actually, I feel like that, sir, personally, and I also feel like that as in our Samhidas, as in our classics, it has been mentioned that when the society was having hampering, the society was with diseases, a symposium was being organized by the then rishis. A symposium gathering was organized. The first thing I feel that for the Ayurveda community, Ayurveda society should organize. In Kali Yuga, it's mentioned that Sange Shakti Kali Yuga, means we should get organized. Ayurveda community across the globe should be organized in one umbrella platform. So from the starting, the main solution for that, I think the organization itself is that structure. So if we get organization, if we get organized properly, we can find out the solution, we can actively discuss the things, and we can actively do some ground level, root level, grassroots works. So from my experience itself, sir, I have noticed that when we have an organized structure, we have more collective minds we will have. With more collective minds, we can do more important things. So I feel that along with this, Bharat is celebrating the Asad Ki Amrita Mahotsava. This is a time to celebrate Ayurveda Mahotsava also. So if we can start up the Ayurveda Mahotsava campaign also, it will be a great event so that Ayurveda community will get organized in one structure on one platform. So along with that, especially a discussion was oriented along with student community, along with teachers community and all. Many of the students, actually, I am also teach many of the students. I feel like that throughout Bharat, I have also visited many campuses when I was Jijnasa National Organizing Secretary of Akhila Bharatiya Vidyarthi Parishad. I felt like that most of the students lack the love for Ayurveda. They lack the love for Ayurveda. The love for Ayurveda should be imbibed in the students, faculties, and all stakeholders. Until and unless the love for Ayurveda and love for the nation is being imbibed, we can't make them more productive to the society. So a love for Ayurveda should be imbibed to the whole stakeholders across the Ayurveda community. Along with this research attitude, today in our Pradhan Mantri's Prime Minister's respected Prime Minister's speech also, he have told about Anusandhan. The word he have used, Anusandhan. The research aptitude, research culture for Ayurveda community also we should imbibe it. There is used to many of the speakers, many of the Ayurveda stalwarts used to tell that doing Ayurveda research is like asking Sati Devi to do Agni Pariksha. We all know that Agni Pariksha, Sati Devi is pure and Sati Devi, Sita Devi is have no negatives, but the circumstances, the society and the circumstances made her also to do Agni Pariksha. So now Ayurveda also is the need of doing Agni Pariksha. More research aptitude, research ground level works are also going on. I was also part of a CCRS research project on Ashwagandha and hydroxychloroquine during the Corona. So more activities are going on, but this ground level, in the grassroots level, in students itself and student speakers and in teachers itself, we should imbibe the culture of Anusandhana as told by our Prime Minister. So until and unless we go in these perspective also, we will reach the Ayurveda Paramavaiva and the Rashtra Paramavaiva. We can reach through the Ayurveda Paramavaiva itself. So with these words, I will conclude my remarks, sir.
Thank you. Adarsh, thank you so much. You know, there is a question here coming. Can Adarsh also tell us where he is We know you are from Kerala, Adarsh, but where are you located in Kerala? And how come you have such a deep passion for Ayurveda? So this is a question that's coming up.
Okay. Sir, my name is Adarsh. I'm from Kerala. Basic.
Adarsh, you are muted. Adarsh, we have lost your.
Sir, audible?
We can hear you now. Thank you.
Yeah. I'm basically Alappuzha, Kerala. Right now, I'm an assistant professor in Shantigiri Ayurveda Medical College. So I was got the opportunity to be a full. I'm a Swayamsevak and we got an opportunity to be a full timer of Sangha also. So after I was also Jitnyasa, Akhila Bharatiya Vidyarthi Parishad का Jitnyasa का national joint convener था. इसका बाद अभी हम विश्व आयुर्वेद परिषद का Kerala state or general secretary है. So I got the passion for love for Ayurveda after starting studying Ayurveda itself, sir. So I were never connected to Ayurveda. After starting studying Ayurveda during my UG times only, I decided that before leaving this space from our society, leaving this body, I should contribute something to the Ayurveda. That's only aim that connects me with Vishwa Ayurveda Parishad and to the across Ayurveda community.
Thank you, others. Thank you very much. We are very happy to have you here with us today, and thank you for bringing these excellent speakers. Now, I'm going to move over to Jayalakshmi Madam, because you raised a very important point, a program that Jayalakshmi ji is running. Jayalakshmi ji, namaskaram. This Adarsh mentioned one program where you are working to make a healthy child. Could you tell us a little bit more about this program and how you are, because this is a very important message for everybody listening to this. We have discussed this in many of our sessions before, but we want to hear directly from you. Namaskaram.
Namaste, namaste. Really, that's a blessing from my Gurunathan that to speak again and again about Suputriyam. Because as per the fundamentals of biology as well as Ayurveda, we know that every living being has a responsibility, or rather, with regards to Indian ideology, that it's a runa, pitra runa. We have a debt to deal with the next generation. As we have birth from our parents, we are liable to give birth, and that's not just for a live system, that's for a better being. So this intention or this message made us, here us means me and my husband, thankfully he's a very one of the best Ayurveda physicians I have ever met. So we both tried to have a progeny for us. And during that time of preparation to be parents, we had come across many references, amazing treasures in Ayurveda as well as the complementing scientific scriptures of India, that it's simple to have a better progeny, and it's very harmonious to have a better parenting too. So we have adopted it for ourselves initially, and now we have 3 kids, and we are planning for more also. Very proudly we are stating that, and it's very easy to manage family along with profession, passion, and social intelligence. So every person should be such a sufficient, vibrant homemaker along with all other responsibilities, not by quitting every responsibilities and bringing our child. No, the children should bring up themselves. It's possible through Indian ideology. That is the core thinking behind Suputriyam. And the methodology of Suputriyam is really personalized.
Jayalakshmi ji, could you put the name of that, could you put it on the chat box also so that all our viewers can...
Sorry.
Very right, sir. We will conduct another webinar on Suputriyam.
Yeah, definitely.
Just gain blessings from you and inspiration from Madam. So we can conduct that webinar particularly on Suputriyam project.
Suputriyam. Thank you. Thank you, Jayalakshmi ji. Thank you so much for being here with us. Please stay with us because there might be some questions. I want to move.
I want to inform sir about tomorrow's last
Please,
webinar.
Pawanji, we saw
Before
that
calling
slide come up.
anybody,
Pawanji will show
before
us.
calling anybody, I would like to request to join us tomorrow because two speakers are with us. Senior most, former Dean Ayurveda, Uttarakhand Ayurveda University, and Dr. Sai Lakshmi VS from Tamil Nadu. So
Thank
please
you.
do join.
I
Thank
hope.
you, sir. Kindly
I hope. Thank you, Pawanji. The 435th.
सर
webinar.
36 हो जाएगा सर 36 हो जाएगा
अच्छा जी,
Thank
Pawanji
you,
will
thank you.
correct
मैं
us.
अभी बनाया, just now design बनाया.
35, 36.
वो
Okay, you are
36
still
है।
making it. So,
Thank you.
35th is today.
Jayalakshmi ji, bahut bahut dhanyawad. Thank you so much for being with us, and thank you for mentioning the special program that you have. And Pawanji will organize a very special event, a complete event on this, and we would like very much to hear from you again. What are your wishes for the future? Haritha, namaskaram. Thank you so much for being with us today.
Thank you, sir. Thank you. Thank you.
Now,
Rajni.
we want to hear quickly some comments from you about what you want for the future on this 75th Independence Day and wishes. We can see the passion from Jayalakshmi Madam and from others. Please, from here, from yourself too.
Sir, Suputriyatinte കുറച്ച് കാര്യങ്ങളൊക്കെ ജയലക്ഷ്മി ചേച്ചിയിലൂടെ I am also associated and working with Jayalakshmi ചേച്ചി. So actually the theme, everything, the main person is
Haritha, can I make one comment here?
Yes sir, you can.
ഇവിടെ നമ്മുടെ കൂടെ ഈ ഹിന്ദിക്കാരാണുള്ളത്. നിങ്ങൾ ഒരു 5 മിനിറ്റ് മലയാളത്തിൽ എന്ന് പറഞ്ഞാല് അവർക്ക് കുറച്ച് പിടികിട്ടും എന്താ ഈ ഭാഷയുടെ ഡിഫിക്കൽട്ടി.
Okay.
വേണമെങ്കിൽ no, don't worry, please talk in English. They will understand.
Okay, sir. Okay.
So you are connected with this program on.
The main person is Jayalakshmi Chechi. Okay. So I have taken some classes and all. So I think that was one of the very ever best ideology. That is, it should be implemented.
When Pawanji will organize a whole program, because we have done earlier several programs on related to that whole concept, but we would love very much to hear from all of you, and we will have you people have you again. But in the meanwhile, Haritha, please continue to support this platform. It's very important that you are here today and you have brought with you some wonderful ideas. And thank you for being here with us.
Thank you, sir. Thank you for this wonderful opportunity, sir.
Now, finally, coming to Rajeshwari ji, namaskar. Namaste, Rajeshwari.
Namaste, sir.
Your presentation is admired by everybody here.
Thank you, sir.
And how you have switched between Charaka Samhita, the depths of Charaka Samhita, the Tri Sutra of Hetulinga Aushadhi, and then you go all the way into urinary markers and crystals, and you are talking, and the ease with which we are going, and then you talk about essential medicines, and you talk about the WHO essential medicine list and the Ayush medicine list, and why we need treatment procedures. So we think, and at least me, I can say, we want every Ayurveda graduate to have this fluency without losing the spirit of the depth of Ayurveda and where it comes from. At the same time, incorporating whatever is out there. And I think Vijayalakshmi ji was correct in saying, what do you mean by pure Ayurveda? Because the tattvas and the shastras are so deep, you can throw whatever at it, it will absorb it. You can throw, it will only become another form of nidan. If you're doing urine analysis using a microscope, it is another form of nidan. It can't be anything else. So this is how I think, if we talk about the pratim samskaranam of Ayurveda, this might be the way. If some of those acharyas were here today, they would have done this.
Yes,
they would have just absorbed all this, urinary markers. They would have done Mutra Pariksha using the original Tailabindu Pariksha, and something else also. So what you are offered us today is amazing. And there are people here who would want to comment on your presentation and all the other presentations too. So please stay with us.
Okay.
Now, we can see many people here. Nilakshi ji is joining us from Assam, from Government Ayurveda College, Assam. And Jagdishwar Domaji is a very senior mentor for us, joining from Telangana. And I can see many, many new names here. So I think the floor is open for discussions, questions. Nilakshi ji might want to add something. I have a few slides I will share, but I will wait for questions from the floor before I can share. I particularly wanted to touch that one point about essential medicines list, and we already have the
I would like to request all the speakers to limit their speech because time is actually over. We have passed 2.5 hours in next webinar also. So we are in webinar from 5 hours.
We are here for 5 hours there.
So please.
So there we are.
In limit short.
If there are some questions, comments from the floor, then we are happy to take this. I know it's very late in India. It's only 6:15 here.
Yes, sir. And now Agni ji's comment is also pending. So we should invite Agni ji first. Because everybody has to take his dinner, sir. It is India.
Pavanji, before Agni ji, I just want to put 1 or 2 images here. Number 1 here is one of my favorite images about the signs and the science of wellness. And this is Nagarjuna's Panchadasha Prakara. Things have not changed from here. It is still the same thing. As long as human beings are human beings, Nagarjuna's Panchadasha Prakara will keep working. Now, in terms of kidney, in terms of what Rajeshwari ji said, Mithya Ahar Vihar, Hetu Samprapti. This is integrative health care for 21st century beyond, except we have a better understanding of the fine detail of the anatomy of the kidney. And our Hetu Samprapti will all go down to that level. In terms of Nidan, on the left-hand side is our Indriyas and what we can see, the cognition, the horizons of cognition. We can only use our senses to see the world experience. And we can use new tools on the right-hand side. We can use simple measurement of electrical activity, but it's still only open to our senses. Yesterday, we talked about shrotas, and we said the shrotas are those, can even be ion channels, in this case, related to the baroreceptors on, and even simple thing of skin, twak. If we look at the fine anatomy, the twak is still the twak, except we can understand some of the treatments much better. Why is Udvartana so effective? And why are some treatments done the way they are? We can understand those things. And these are all areas that are known to Ayurveda for thousands of years, but only now people are starting to win Nobel Prizes for these things. Last year's Nobel Prize for Medicine was given for discovery of receptors for temperature and touch, when Ayurveda is already using temperature and touch in practice for thousands of years. And this is where we are trying to go. We are trying on this special day, we are echoing that call from Prime Minister Modi ji about one earth, one health, world order. And there are big challenges here for globalization of Ayurveda and Ayush systems. And some of this will be discussed at the 9th World Ayurveda Congress coming up in Goa, starting on the 8th of December. There are 16 themes. Many of your students will be presenting there. And there are new technologies that are coming up. We had all these speakers present to us, Ayurrhythm, Nadi Tarangini Turiya, Nadi Swara. These might help improve our technologies for the future. And this is an area that is waiting to be understood, that Pavanji started today with about Panchaprana. Somewhere in yoga is an understanding that we will try to uncover in the time, in the years and decades to come. I hope we can take our children, our students into those directions also, like what Rajeshwari has shown us, how we can combine modern and traditional Ayurvedic systems, the medicines, how they are to be used. I hope this can be the spirit for the future. Agnihotriji, Pranamji.
Namaskar, sir. Namaskar. Thank you, sir. So, namaskar and thank you to all. We are having 2 consecutive webinars in continuation. Before we say anything,
सर मेरी कमर जकड़ गई है 5 घंटा बैठे बैठे कंटिन्यूअस.
Sir, I am having 101 temperature. Just started sweating.
We should be limited into our time limit.
So I will only say this much, that is in our first webinar.
Please take rest. Please take medicine, sir.
Yeah, I have taken. Now the sweating started. The throat is also out of order, but the zeal is there, the enthusiasm is there. So just to attend the flag hosting today in Tilak College, I could not sleep last night simply because that I have to get up early and get ready. And that's why the sleep was completely disturbed. And today also, so many times either and there, some raining exposure and all that. But still, so in our first webinar, including Dr. C.K. Katyar sir, we were 17 in our discussion. For the question paper, we have got no key, but we submitted our answer sheets, and now it will be decided its future. And very, very new faces are today there in our both the webinars. And as far as the second webinar is concerned, all the 3 speakers really justified themselves on the topics they chosen by their own, especially the honesty by Dr. Harit told about that she is MS, she is a surgeon, so she is confined to Shishya Sangita, but still follow Charak Sangita along with its principles and also the Bhagavata. So overall, this is what we are needing, that our present time teachers should be having this much of deep knowledge with a greater presentation along with the examples over the patients, that they are getting the reals out of their own or our pathy. So it sounds like anything, because it is said that the actions are more means giving the power instead of the words. So she very smoothly presented her paper and her work. So without taking any extra time, everything is being heard and recorded, also been viewed by the spectators in our YouTube. So first of all, our congratulations and greetings to Adarsh ji, as he introduced all the 3 guest speakers, which are so sound with their subject. So Adarsh ji, thanks so much. And thanks also to all our guest speakers for their presentation. Greetings from our side, and also our regards and thanks to Dr. Domaji, Namaskar Dr. Domaji, Professor Mipi Sharma Sahab, our Professor Madan Thangvelu sir, and again all those persons who joined today, including Dr. K.K. Dwivedi ji, our senior persons, Alok Sharma ji, Rehma Malini ji, Jyoti Lakhani ji. They made, I am also of great praise as far as the Jyoti Lakhani is concerned. She came forward with that as far as the media communication is concerned, we will do. This is what such type of volunteership Dr. Pawan Sharma is interested to have. So one pillar is now very sound. Dr. Jyoti will do so many things, and as per her need, we will be in position to communicate any sort of documents and other things. So today's webinar is very successful. Thanks to all our dignitaries, and our greetings to our guest speakers. Thank you so much. Over to Professor Madan Thangvelu sir.
I hope you will take good care of your health. I know you send me photographs of standing in the rain in Tilak Ayurveda Mahavidyalaya, but so happy that you could connect with.
This is out of all your efforts, sir.
Hari Om. So happy that you could connect with Vishnu Joglekarji. Our network is widening. I hope the commitment that we are showing here, like yourself, as Pavanji says, yesterday, others, yesterday, last few days, we finish our session at 12 o'clock. And today is an early night for us. So today, because it is a day of national importance, Pavanji, आज थोड़ा जल्दी
That's why
खत्म
we
करें.
have spent 5 hours on webinar.
चलो, but the
इसीलिए मेरी
quality.
एक request है sir, क्योंकि everybody can move, everybody can eat, everybody can have drink, but as I am host, I can't do anything. I means 5 hours at a stretch for slip disc patient. I am slip disc patient.
But
That's
what
why I am requesting
Pavanji,
again and again. We should consider
Your achievements are also uncountable. This you must feel. This you must feel that your achievements are uncountable. Within 10 minutes, you got tomorrow's speaker. What more you can dream and achieve?
Thank you. And within 5
10
minutes, I have met the difference.
how wonderful it is. Really, I am in Pune. Dr. Professor Gakkar sir, he has been principal of Rishul College. He is there in Haridwar in Uttarakhand. You are sitting in Ratlam. How funny it is. Within 10 minutes, the whole communication along with this, and this is really satisfying me that the moment I thought a new name, and he's master of Charak Sangita, he's teaching Charak Sangita. So this is again our achievement of our IRES. So your achievements are countless. This much I can say. Thank you so much.
We have
Namaskar.
Pavanji, we have one new person, Atharva Bojashatar. Atharva ji, namaskaram. We would like to hear from yourself,
Yes,
Atharva.
definitely.
Atharva, please unmute. We want to know if Atharva is not able to. We have Kirti Shrijit. Kirti, namaskaram.
सब खाना खाने चले गए हैं.
अच्छा, सारे चले गए.
आजादी मनाने चले गए हैं.
कोई है ही नहीं हमारे साथ. ठीक है,
बस हम ही लोग हैं.
अकेले लड़ेंगे जी, क्या करें, बाकी लोग तो नहीं.
डॉक्टर कटियार साहब आए थे, बहुत बड़ा असाइनमेंट दे गए हैं और उस पर आपका चिंतन मनन शुरू हो जाएगा. टाइम बहुत कम है, 18-15 आज हो ही गई है. 19-20 तक उसको आप फाइनल कर दीजिए.
नहीं जी, इसमें पावन जी के पास है पूरा प्रोग्राम कि कटियार जी को
20 तारीख
ले आए मीटिंग के लिए.
20 तारीख को ले लेंगे सर, शनिवार.
20 चलो, और जयलक्ष्मी जी भी आएंगे हमारे साथ, क्योंकि उनकी
लेकिन टाइम 8 बजे 8:30 बजे टाइम नहीं होगा सर. My whole life, दिनचर्या, ऋतुचर्या, we are explaining to the customers and we are not able to maintain.
We are expiling दिनचर्या.
ब्रह्म मुहूर्त में उठने वाला आदमी, मेरी पूरी दिनचर्या, I want pure sir. So that's why I want to request to limit. क्योंकि मैं टूर में हूँ, इतना कंटिन्यूअस नहीं बैठा जाता. ट्रेन में बैठना, बस में बैठना, फ्लाइट में बैठना, वो गड़बड़ हो जाती है सर.
पवन जी, हमारा हाल ये है कि कोई चिंता ही नहीं उस तरफ कि दिनचर्या ऋतुचर्या.
बैठ गए तो बैठ गए.
बैठ गए. चलो जी, बहुत बहुत धन्यवाद सबके लिए. आज की स्पेशल ये जो दिवस के लिए हमारी तरफ से बहुत बहुत विदाई. राजेश्वरी, जयलक्ष्मी जी, Valra Sandosham, thank you very much. Harita, Valra Sandosham, thank you. Adarsh, thank you for bringing so many amazing speakers to the platform. Valra Sandosham. And please continue to support this platform, because you know who are the people in Kerala, locally, in Karnataka maybe. So please introduce more people, and particularly students, MD students, or BMS students. Also, the others from the other, I know Kerala, Tamil Nadu has a very strong Siddha following also. If you bring some people from there.
One more thing I want to communicate to Adarsh ji. Really, he's dynamic person. I have heard more about him. After his phone, I have inquired about him. So he's really dynamic person. But on this platform, we are inviting Pakistanis also. Though I am from Sangh, I am strictly from Sangh, but we are calling from Pakistan, Afghanistan, Dubai. So our doors are open, don't worry. And we have indicated yesterday that we please support us, don't oppose us.
Sure,
Sir, it
sure.
is a matter, sir, it is a matter of
Madam
academy.
Nair, I have
Sir,
requested.
Sir, it is a matter of academy, so there is no problem. National foundations are no value.
Agnihotri ji,
National
Charak
boundaries, political boundaries, party boundaries, so many. This others and me, both are in such states where we are being crushed. Definitely. So
He is a person of
definitely,
ABVP and now VAP. ABVP and VAP. So he can manage very well. May it be Kerala, may it be
वहाँ
Andhra.
CPM है
Telangana.
साहब, CPM है, मैं भी वहाँ उसके 24 साल शासन में रहा हूँ, बस CPM है, और मेरे यहाँ उसकी दीदी है, CPM की दीदी, जिसने CPM को निकाल दिया, वो दीदी बैठी है, उसको तो कोई परिषद लग जाए आगे तो वो सीधा संघ समझती है, कोई भी परिषद नाम के आगे लग जाए तो वो सीधा संघ समझती, मैं क्या करूँ उसका।
पवन जी, आपने जो बताया, कहीं अग्नि, इसमें चरक संहिता में एक सेक्शन है जहां पे बालूचिस्तान से कोई आ रहा. I don't know, there is one section in Charaka Samhita which talks about the man from Baluchistan who's there at the discussion.
भद्रकाप पे वगैरह शिष्य लोग थे ना.
हाँ, ये देखो जी, वहां से बलूचिस्तान से आ रहे थे.
ये लोग आ कैसे जाते थे सर? मैं ट्रेन और बस में सफर करते करते परेशान. ये आ कैसे जाते थे?
हिंदू कुछ के दर्रा से आते थे और रास्ते में जो मिलता था वो खा लेते थे, कोई इनको इनडिस्क्रिमिनेटली. वो
उन लोगों ने कितना संघर्ष किया है, तब हम लोग आनंद कर रहे हैं सर.
तब आप आजादी को मजा ले रहे हैं.
जैसे मोदी जी शहीदों को याद कर रहे थे, तो हम लोग एक प्रोग्राम आयुर्वेद के शहीदों के नाम रखे.
आयुर्वेद में सर्विस करने वाले लोग सब लोग शहीद ही होते हैं.
अरे ग्रेट.
वो उन्होंने LTC मिलती है ना, वो दुनियादारी जानते हैं, वो कुड़ते रहते हैं 30 साल तक.
हे भोलेनाथ, हे भोलेनाथ.
अग्निहोत्री, शिवरात्रि, विश यू स्पीडी रिकवरी. ये जो आई डोंट नो,
कल बहुत टफ दिन होगा. कल बिटिया का सामान आ रहा है. आज महाराष्ट्र का बॉर्डर खुल जाएगा तो कल सामान आएगा. कल पूरे दिन डिलोडिंग. आज भी 3 चक्कर होटल से और वहाँ सोसाइटी तक लगे. बड़ा बेटा बॉम्बे से आ गया था गाड़ी लेके, तो भी अच्छा इनिशियल सामान लेना है, माने सब क्लियरेंस से मेंटेनेंस का बहुत टफ हो गया. और बच्चा 3 साल का बच्चा, आना जाना खाना. 6 बजे खाना खाया लंच आज, तो तभी तो थोड़ा लेट हो ज्वाइन करने में, फिर बस स्किप हो गया शाम का. चलिए हो जाएगा सब मैनेज हो जाएगा.
मेरी आवाज जा रही है
जी?
आदरणीय जगदीश्वर जी,
अब सोचिए.
आज उनका नाराज होना तो अब कहाँ है?
नमस्कार 11 बजे.
जय हो जय हो जय हो. सबसे पहले तो मैं आपसे क्षमा मांगता हूँ,
जब लेट ही होना फिर लेट हो गया.
आज इंडिपेंडेंस डे में जगदीश्वर जी को मैं भूल गया, ये मेरा अपराध हो गया. दैट इज कॉल्ड प्रज्ञा अपराध. आई एम सॉरी फॉर इट.
Nothing of that sort.
नहीं सर, आपके बिना तो ये वेबिनार अधूरी है.
Nothing to
मैं
think
आगे
about.
से ध्यान रखूंगा. प्लीज एक्सक्यूज मी. जी सर, फाइनल कमेंट सर. जगदीश्वर,
At least fearful of Ayurvedic system of flourishing here afterwards is one is mercury restriction. And another thing is this: for everything evidential in case of philosophical system cannot be derived. For example, if you say that dharma, artha, kama, moksha, these 4 only, if discussed, in what way we can give evidential for dharma, what is jaiva dharma, what is bhagavad dharma, can it be evidential? Because it is related totally soul, and it is related to human being, to its his knowledge. If anybody asks that, show me Shat Chakra, can we show it? Evidential. In what way evidential? How long you can go for evidential? You cannot, because evidential is a limited subject of the human brain, where it can reach. But for unlimited macrocosmic system, your brain will be shut off. That is why how far, because the other countries, the heritage of Bharat it itself is a high standard one, right from the emergence of the Srishti. That's why In what way evidential? You cry on for evidential. Number one thing about dharma, I referred. And for example, artha also. Artha in Sanskrit, because Ramdas ji was there. Ramdas ji is very better to give all in Sanskrit description. That artha does not mean only for money. Artha means even gain meaning, even meaningful life. And whatever you gain in human life, it is called artha only. Whatever you gain, either physical or by mental, this artha. And then kama. Kama means, is there anything that which is related to desire? If for cheap interpretation, if it is told that it is kama means something we think about sexuality. But whereas the kama means actually it is related to lust in English terminology, the interpretation of lust. And here if it is described as a kama is equivalent to lust. Lust is the only thing which is acquainted with a human being endlessly throughout the life. But whereas if it is being turned lust into love, then he becomes a godly oriented, spiritual oriented. Can it be evidential? Nothing. If we ask that, how can we give love and lust evidential difference? Likely. Moksha, the last one attainment of one's jivatma into Paramatma. That is why my Gurudeva gave a sutra that if yoga, chitta vritti nirodha yoga, nischinto yoga yuchyate, then he's totally their shortcomings, samyogo yoga ityukto jivatma paramatma. When
You are
jivatma
very right,
merges
sir.
with paramatma, then only it is yoga and it is moksha. Likely, what evidence?
Today, sir, our topic is different. Today, our 15 point, because we are of family, so they were not understanding my sentiment, but kindly understand my sentiment and please write down. You are the genius expert, sir. Please write down 5 points and we will discuss. We will come again with that point agenda. And second thing also, I have requested, this was the draft proposal for executive committee. So, जो आ गया सो अपना है, जो नहीं आया सो सपना है. This is my standard dialogue. So we will definitely think to replace. Unfortunately, we are giving regard and that regard is not being accepted. That is also a awkward situation. So sorry, Jagdishwar ji, I will definitely, you are the authority of this Ayush Samriddhi and we will consider that. But please, as time is over, maximum. So please write down 15 points, 5 points of Ayurvedic strength, 5 points what we should do, excluding webinar, and 5 points what responsibility you can take for Ayush Samriddhi. So we are pinpointed today. We are not here. We have not discussed any lecture here today. So please be pinpointed. This is my humble request. You are the authority of the Ayush Samriddhi, sir. It was my mistake that your name was missed. But today's agenda is absolutely pinpointed. In next webinar, we will try to keep agenda as pinpointed, not as a gossiping. So that will be more useful for the public. Because this is the general complaint from the public. That your webinars are going out of the time, so we can't spare that much time. It is regular complaint, 1 or 2 phone daily, particularly of ladies, particularly because they have to prepare food, they have to serve food, they have to eat food. 3 responsibilities are there with ladies. So we will fix the time for speakers also and for discussion also. This is my humble request with folded hands. Jagdishwarji, please. 5 points. 5 points, sir. 5 points. I want to listen today only 5 points. Modi ji has given inspiration. Panch Prana. Those Panch Prana I am repeating as a moral duty of citizen in Ayurveda. He was reminding again and again, 130 crore public. should know the civic sense, should know the citizens' norms, should know the citizens' responsibility. So I am requesting Ayurvedic experts to know their responsibility to develop the organization and develop Ayurveda, but specifically pinpoint-wise action plan, because we are unnecessarily lengthening that topic without any necessity. This is my
Should I
humble
give now
request.
only? Should I
5
give
points,
now
sir,
only?
5 points.
5 points should I give now only?
No. 1 or 2, sir. 1 or 2 as a blessing, sir. You
Okay.
are 5 points. You can
Okay.
give later on.
Sir.
1-2 points, but on the topic Dharma Artha Kam Moksha.
Okay.
I was stopping CP Sharma ji also on that.
The first thing is that Ayurvedic, for reference, Rasa Shastra did not contain or did not refer any expiry. For that, if action is being taken, well and good, it will survive for a long time. Number one. Number two, because I am appealing to Ayurvedic community. I am appealing to Ayurvedic community. Number two is that Asavarishta section does not include any the preservatives. If it is gone to preservatives, then it is not at all be considered as Ayurveda totally. As long as the preservation is done, then the self-generated alcohol will come out and it will strengthen the combination of the medicine. Then in what way we can support the preservative, and in what way we are treading the path of Ayurveda? Second, number, I think I gave 2 references. If these are being actually organized in a systematic way, then I say that Ayurveda will survive. Otherwise, you will be crushed down. To this extent, now I'm asking that who are doing MD Rasa Shastra, they are not being provided mercury. If they are not being provided mercury, then what is the meaning of completing MD in Rasa Shastra? Because when Tirupati University, Venkateshwara University information is coming, because a boy who is very sincere to me, his wife is in MD for Rasa Shastra. Day before yesterday, he was telling me like this, sir, they are not providing mercury. Like that, in what way you go ahead? Then we should be very serious. I am telling you, I should not take the reference that the thread, the rope is given to you, Ayurvedic people, and go to gallows. We ourselves are putting. If these are not confronted, then we will not survive. So many things are there. Thank you very much for 2 or 3 references I gave you.
Thank you very much. Generally, sir, Asavarishta is being adulterated by direct alcohol, not by preservatives. Manufacturers are saving time by adding alcohol.
It is
not big
absurd
companies,
practice.
but mediocre companies.
For your information, Dadaji, for your information, I am asking companies, especially I asked Arkashala, Ayurvedic Arkashala Satara, that they themselves claim that, sir, classically we are manufacturing. Please don't suspect. We are putting 20 years or 20 years or 25 years like that. Why it is so needed for putting the expiry for 20 or 25 years? Why don't you ask the law?